So I'm happy to take questions. Mm-hmm.
Great, thank you very much. There's a lot being discussed and written about now around the notion of physician burnout and healthcare burnout in healthcare systems.
Right.
And for all the ways that this is improving care, as you're talking, I'm wondering about students coming in who are trained and learn how to capably address problems around social determinants and barriers in the system. Much of what I experience as a clinician around fatigue and frustration in the system is because I'm working in a broken system and I didn't learn how to fix it. I wonder if you're thinking about outcome measurements, or we should be thinking about outcome measurements around is the resilience of this group of students who's learning early on. I'm empowered and I actually understand this and I can do something about it. If you feel more vitality in your own work than you do for our students and our practicing health professions workers feel when they don't have that.
Right.
The resilience piece may be something that we ought to be looking at. You may already be doing that.
Well, that's really interesting. We haven't thought about resilience, so we'll add that, which is why we love our consortium. But we are really interested in measuring agency, and that has really been a part of it. I will comment just a little bit in that the students had an opportunity to speak to the Pennsylvania State University Board of Trustees recently, and among the questions they asked them was, you know, if you're going from this 2-pillar model to this 4-pillar model with programs like Patient Navigators, how do you find the time? You know, are you exhausted from this? And actually the students said no. And what they said is that we understand that we need to learn this. And so we are already working together. And they talked about the teamwork and the Facebook and blogs and sharing networks. And they are becoming teams, even with their basic science learning, understanding that all this learning needs to fit in. So I think from the standpoint of burnout, maybe they're better than we are at understanding how they need to transform the way they learn. So thanks.
Thank you, an excellent presentation. When you mentioned time just now, it was in terms of the student having time to do this work. One of the things we hear often when we're hearing about curriculum redesign is there's no time in the curriculum, and you've made time for a 3-semester experience. So given that things are mostly can't be an add-on, something had to go out, maybe you could explain to us how you made time, what did you remove from the curriculum, a little more information about that.
Yeah, thank you. So it's interesting. Let me sort of start with this part of the story. As we had the opportunity to write this grant proposal, one of the things that I kept doing was going to different committees saying, what if we get this grant and we can't figure out how to get it in the curriculum? Do we just give our money back? You know? And we just kept being told, just do it. So I think that, and I'll add to that. So one thing that I think is what I have learned is the power of even small funding, because what that does is it makes a promise, the promise that your school is making to that agency, but more important, the promise that you're making in your proposal, the promise to that vision. That I think is the first thing. There was an understanding that we made a promise. The second thing that we did was we began to look at where in the curriculum were there perhaps topics that weren't being taught as effectively, or perhaps holes where maybe more content was being given than needed to. So what we did was to bring together the evidence-based medicine course and a course that we had already had on social determinants, and said rather than throwing out the baby with the bathwater, can we work together? And that's become a very powerful team. But in the end, I think the point you're making is really right, which is there needs to be buy-in from the top, that this is a pillar. If you notice, those pillars were all equal, weren't they? They were all, we need to have that buy-in that humanities, systems, the sciences, and clinical care are equal pillars and all important. It's a wonderful question. Good? All right, we'll do one last one.
Hi, Mary Joan Ladden from the Robert Wood Johnson Foundation. Just 2 questions. First, do the students have an opportunity then as patient navigators to work within the community with the community agencies to really look at the resources within the community and the needs within the community. So not just at the individual patient that they're seeing, but within the community. And the second question is, and I might have missed this, is there an interprofessional component of this? Is this just for medical students, or is it for other health professionals?
Yeah, so this is the beginning for us, and right now we've done it for the medical students. We're not quite at full scale yet. We've done it for 85 of our 150, and in July we go live with 150 students. We have a PA program that's just in its first year, just finishing up its first year, and we've talked with that program about trying to work out teams that would be now PA students and medical students. I think it has enormous potential for that. And your other question, I'm sorry, the first question?
It was around the community and
Yes.
the students getting impact in the community.
Yeah. So depending on the site, some do that more than others. But the other thing I think, and I'm sure you can see, is that this is a concept using medical students as navigators that's very new. We have no model. And so what we think is happening is we're seeing ourselves iteratively understand how the students can become navigators. So a lot of what they're doing may not be true navigation in that they're not at the moment going through the full continuum of care with the patient. But what we think is that over time we'll be able to evolve this into something that will really be a very meaningful experience for the students. And some of what you're talking about I think will evolve. The other piece, and I know we have to end, so I will end on this, is this. We have gone to all kinds of health systems, all kinds of agencies. And the politics, as you all know, can be incredible. But for those in our team that have done this, what they said is it takes about 45 seconds for these groups to stop talking politics because they begin to embrace this concept so rapidly. And all the rest of the time is all about how that particular agency or system or clinic can utilize medical students. It's really been a very exciting process for us. Thanks a lot.